tips that we would give the carer of a patient with a blood cancer in terms of minding their own physical well-being would be to exercise well, to eat well, to sleep well, to really nourish themselves when they're looking after somebody or when they're in a position of caring. Certainly we would be advocating that somebody engages with really good sleep hygiene, that they're actually going to bed at the same time, limiting any stimulants or caffeine, trying to avoid as much disrupted sleep patterns, not to take sedatives or sleeps to aid sleep, that they would be better to go out and engage in some physical activity, to exercise maybe for short bursts, for maybe, even if time is quite limited, just to take short bursts of maybe 10 minutes at a time, to get out, to actually have a break from caring and just take a simple walk or go for a swim or do something that you're actually removed from your caring environment. Relax, and in terms of the endorphins it will release, it'll really help with their physical and mental well-being. Often when we would recommend a patient attends a cancer support centre for either counselling or one of the touch therapies, we would like to suggest to the carer to take that window of opportunity to go and access some of the services for themselves. Somebody who's been caring for a number of years will suddenly find that they've become fatigued and burned out by it. So we would recommend that a carer accesses services early on in a patient's diagnosis so that they stay well throughout the trajectory of that illness. A diagnosis of cancer is very, very difficult, and it's the news and the distress that a diagnosis brings with you can persist for some time. So your emotional well-being is absolutely key. Certainly when you're caring for somebody, it can be all-consuming, and it's really important for somebody's mental and physical well-being to actually take a break from that on occasion and to do something that they enjoy, take some time for themselves in terms of their own mindfulness and well-being. We would ask them to look for help from their friends or neighbours or other family members. It's all about delegating your tasks, asking for help. Don't wait for somebody to come and volunteer that they're going to help you. If you get in there and just say, actually, can you do that? And be very precise about what kind of help that you actually need. Carers often feel that it's not them that has the cancer diagnosis, so that they don't need all this additional support. But sometimes for a carer, the emotional burden can actually be far weightier. The person that's caring is in a very different position in that they're watching and observing and minding and prioritising and delegating, and they're very, very busy, and it's very difficult to actually stop that and to actually have a break from caring. And it's a very key skill to learn. You're the carer of somebody with a blood cancer, and a blood cancer behaves differently to one of our solid tumours in that it's often not curative. And that we now treat it as a chronic illness, so you actually live with your cancer much longer. So expectations of your care, will be ongoing. It's not something that you will be doing a burst of a year or 2 years. Often it will exceed that time frame. So going into your caring responsibility, I suppose, well informed about the type of condition that you were actually going to be supporting. Often we would find that carers of CLL and multiple myeloma patients are actually family members, which also creates a different dynamic in that it's very difficult to be boundaried with your parent or with your spouse, whereas with a healthcare professional, they tend to ask less of us, but far more from a family member. We would encourage a carer of a patient with a blood cancer to have an early and open, frank discussion about realistic expectations, and to set those boundaries and expectations early on in somebody's cancer diagnosis. I think when you become a carer, knowing the treatment plan, meeting with the medical team, knowing how much additional visits you will have to take to the hospital, knowing how long treatment is projected to go on for, and how many additional trips you will need to make to these to your centres of care. They may find it useful to document all appointments in a calendar or in a notebook, and it's really just having a planning ahead, knowing that treatment dates aren't going to clash or coincide with special events. Speak to your clinical nurse specialist or to your medical team, who can often move your appointment dates, so that it's all about creating, normalcy in life, that people aren't missing special and important events, and in making sure that that things can be as normal for them as possible during what is quite an abnormal and upsetting and distressing time for families and carers. In terms of balancing a normal routine and maintaining a normalcy in what's often quite a complex and difficult and challenging time, and we would say to people really to be grounded in their social contact, see their friends, try and maintain as much normalcy as they have previously. So we would encourage a carer to actively plan to prioritise events and occasions and birthdays, communions, and to prioritise that they're able to be freed up to attend and to enjoy all these events. The more you can access services to support you, and knowing where you can access these services is key to caring for someone really, really well. You can access these services through the Irish Cancer Society nurse line, or through one of our daffodil centres, or through any of the cancer support centres. We would be encouraging carers and patients to speak to their local Department of Social Protection to inquire about taking carers leave, which is governed by the 2001 Carers Act, which allows them to leave their place of work for up to 2 years to allow them to care for someone. We would encourage patients and carers to access very reliable and robust online information. We would be directing them to the Irish Cancer Society website, onto CLL Ireland, onto multiple myeloma. There's a lot of networks and forums that are available to them. We wouldn't be encouraging patients or carers to put their diagnosis into search engines, where you would have a lot of often misleading and inaccurate information that wouldn't be pertinent to their health and to their treatment plan here in Ireland. There's also a lot of our websites that we'd be directing you to would have community online chat rooms where you can talk to people with the same diagnosis, or you can access in contact with other carers. Peer-to-peer support is very important. Carers often feel very lonely and very alone in their caring for somebody. Counselling can be very useful to carers. They can access this through either meeting one of the nurses in our daffodil centres or in one of the cancer support centres in their locality. You can access additional information through our Caring for Someone with Cancer publication, which you can access off our Irish Cancer Society website, or avail of it in one of our daffodil centres, which you'll find in your hospitals locally.